For a blood transfusion, you need blood product, blood administration set, normal saline IV infusion, an IV pole, venous access if peripheral site with a 20 gauge catheter or larger, alcohol or other disinfectant wipes, clean gloves, and a second registered nurse. First, you're going to verify the medical order for transfusion of a blood product. If ordered, administer medication at least 30 minutes before initiating transfusion. Whoops. Gather all equipment.
Is it this white one, Paula? Is it this white binder?
And perform hand hygiene. And provide privacy. Okay. Prime the blood administration set with normal saline IV fluid.
Or you can just say, checking the number like you're reading numbers on there.
He's priming the IV tubing.
There would be something in there to contain that sterile.
Yeah, this has a cap on it.
Wait, Victor. Close that and fill up your chamber first.
It's close. So,
And then fill up our chamber with normal saline.
Turn it upside down.
So that's all filled up for us.
Leave it open. Don't worry, it's not under because that's closed.
No.
That's all filled up with liquid.
So now, let it,
Now you open that.
yeah, prime it in the trash. Line is being primed. There we are.
All you need is a few drops.
All right.
okay.
Obtain a blood product from blood bank according to agency policy. Scan for barcodes on products if required. 2 nurses compare and validate the following information.
Mr. John, do you have any allergies, or have you had any problems in the past with any past transfusions that you had any type of allergic reaction, like deep breathing or anything like that? No? Okay, that's good. Patient fires. Perfect.
verifying patient's name, date of birth, and blood transfusion number and type of blood.
Perfect.
An expiration date.
And expiration date.
Obtain baseline set of vital signs before beginning transfusion.
I'll get my stethoscope.
Vitals are taken. Put on gloves. Close the roller. Yeah.
We didn't do any of the steps.
Yeah, we did. We just did all that. Close the roller clamp closest to the drip chamber on the saline side of administration set. And close the roller clamp on the administration set below infusion device. Close the roller clamp closest to the drip chamber on the blood product side of the administration set.
Get that down.
Yeah, let's do it.
And spike blood product.
I did verify. I said expiration.
Yeah, she said verifiable last time.
Yeah.
He had it with a different bag.
Hang blood on the IV pole and open the roller clamp on the side of administration.
You're supposed to do it.
Don't I need to for this first?
Well, yeah, you can.
Okay. Scrub the head. So we do scrub the head for 30 seconds. Okay, 30 seconds later.
Actually, we don't have to do that if it's already connected to them. It's already connected to them.
Now you can attach the IV line.
Oh. There.
Start administration slowly and stay with the patient for the first 5 to 15 minutes of transfusion. Open the roller clamp on the administration set below the infusion device. You wanna read? 17.
We're on that right there. So it's been 15 minutes. Yeah.
Reassess vitals after 15 minutes. Obtain vitals, therefore, according to your faculty policy.
So I would perform vitals.
Maintain, after 15 minutes, maintain the prescribed flow as ordered or deemed as the doctor said.
Yeah, everything's good. Blood is flowing.
Keep a lookout for early identifications of adverse reactions.
Now, Miss Ruby, I need you to make sure if you have any rashes, itching, shortness of breath, that you let us know. If you're feeling any just different from the infusion, you need to let us know, okay?
If reactions does happen, stop the blood transfusion and quickly administer normal saline for IV fusion. Take down all old IV hangings and return them to the blood bank and contact your primary care provider.
It's been 30 minutes. Now we are going to assess his vitals again. Blood pressure's good. Everything's good. He looks pretty good.
After 15 minutes, it's done. Transfusion prescribed rate, and after 3 hours, transfusion is now complete. And take down all
It's not so full that we can't see it drip though.
And we don't see any redness or anything on the site, no inflammation, so his IV site looks pretty good.
When all of the blood has infused on a patient, clamp the blood off, and only have the normal saline running.
I think it says 15 minutes later.
I have gloves on. Okay.
Yeah, I think we can do that.
Yeah.
What?
Yeah, symptoms.
After blood has been clamped off, obtain new vital signs.
So I get new vital signs, and everything's the same as before.
Okay, dispose of blood transfusion equipment or return blood to blood bank. After normal saline has flushed IV tubing completely above all blood, you will put up a new IV set.
So, here.
All blood must be transferred in a biohazard bag.
Change out this tubing, and then we'd have normal saline coming down. We'd finish this one first.
After everything's done, remove all equipment, ensure comfort, remove gloves, lower bed to the lowest position, make sure side rails are up and patient is comfortable. Monitor your patient for 1 hour after transfusion for any signs or symptoms of delayed transfusion reaction.
Go ahead and take this out.
Yeah, because they said we have to include vital signs, name, date.
I would lower the bed, make sure that the patient's comfortable, ask them if they're feeling okay. Okay, and put the call light within reach.